move to next now. So next prescription is this. Who wants to read the prescription for me?
Just one more thing before we move, please.
Sorry?
Just a clarification before we move. The dexamethasone. Is it that in all cases where we're not given the duration, we put it in the once daily prescription part? For instance, if it's IM dexamethasone 12 milligrams, maybe 12 hourly for the next 2 days, will it still be there or under regular medication?
Sorry, can you? Your voice is breaking for me. Can you repeat it for me? I'm really sorry.
Okay, thank you. I'm saying for the dexamethasone prescription, did we put in the once or pre-medication, the part we put it, is it because the duration was not given?
Duration was not given for which one?
This same prompt, dexamethasone, you know we have to prescribe dexamethasone and erythromycin just before this. Yeah.
Okay. This one?
Yeah. Yes. Dexamethasone 10 milligram 12 hourly IM.
Mm-hmm.
So because it's not a starting medication here, it's to be given twice.
The thing is that dexamethasone is given as a the guideline says you can give dexamethasone as 2 single doses. 2 doses,
Okay.
and you can either give it as 12 hourly or 24 hour apart, right? So if it is written as 12 hourly, you can give it as 12 hourly 2 doses. If it is 24 hourly, you can write it down as 24 hourly, right?
Yes,
All right, so let's move to the next prescription. Who is going to read the prescription for me? Anyone, please? Okay, fine. Let's start it without wasting any further time. So you are F2 in medicine. Mrs. Andrea Brighton, age 81, weight 62 kg, was diagnosed with non-valvular AFib. Patient had cabbage 10 years ago. She was admitted to medical ward and developed hospital-acquired pneumonia recently. She has been given 200 milligram per oral doxycycline stat dose. Her recent eGFR is 31. Please prescribe maintenance dose of doxycycline for 5 days and prescribe her regular medications, which are APIXABAN 5 milligram BD and atenolol 25 milligram OD. So can you please look up for the maintenance dose of doxycycline in BNF and tell me what it is? What is the dose of doxycycline? $200 is the stat dose and maintenance dose is 100 milligram OD. Yes. So 100 milligram OD is the maintenance dose for doxycycline. You have to write it down for 5 days. And then next thing is this, APIXABAN and atenolol. So they have written down an important thing in that task. Can somebody point it out? Something that is going to affect the dose for APIXABAN. And you have to consider that before writing it down. Anyone?
that's eGFR.
Yeah, eGFR is low. So with this eGFR, you are not going to write down full dose of APIXABAN, 5 milligram BD. If you can open BNF, and then BNF for both of these drugs, APIXABAN and atenolol, because you are going to prescribe something, patient is having low eGFR. So check for renal adjustments. So if you open for APIXABAN, and there are different things for APIXABAN. APIXABAN is given for a lot of things, for prophylaxis of DVT, PE, as a treatment dose as well. So, and then here, because we are going to give it for non-valvular AFib. So you are checking the dose for this, because dose for stroke and systemic emboli in non-valvular AFib is different, and dose for PE and DVT is different, right? So check in the proper column, and then the dose is 5 milligram twice daily, but 2.5 milligram if patient is having the two of these things. If age is 80 and above, weight is 60 kg or less, and then serum creatinine is more. So if whenever GFR is low, serum creatinine is going to be more. It means that patient is having some background renal problem, CKD or something like that. So you have to adjust the dose now. So what will be your new dose now? 2.5 milligram twice daily instead of 5 milligram twice daily. And for atenolol, if you check renal impairment, there is a proper separate portion for renal dosing, renal impairment. So you will check there, and it says with oral dose 50 milligram daily if GFR is 15 to 35. What is our GFR? It is 31. It means that we can give this atenolol dose of 25 milligram. If it is below 15, then we have to make the adjustment. So we are only going to change dose of APIXABAN, and we are going to write atenolol as it is. And then doxycycline for 5 days. We have checked the dose in BNF. Another thing, if patient is on something else, like instead of atenolol, maybe patient is on ACEI, ramipril, captopril, something like that, then please check the dose. And if it says stop the drug for the time being while GFR is low, stop it. Don't give it. Don't fall into the trap. With low eGFR or AKI, we have to stop renal nephrotoxic drugs. So ARBs and ACEIs are one of the nephrotoxic drugs. So please check those things. Sometimes they can change the drug. Instead of atenolol, it can be something else. So check BNF, check for the renal dosing of that drug, and then write it down. Is it clear?
Doctora, please, how did you get those pages from the BNF? I mean, the doxycycline and APIXABAN, and I guess doxycycline as well.
Sorry?
How did you get it?
This is an app, BNF app, phone app. So I get it from that.
Okay.
Okay. You can, if you are in UK, you can download the phone app as well. But in the exam, for the real purpose, the phone app will be important. In the exam, actually, you have to check in the real BNF, the book one.
I got you. How just I mean the book one, how could I get it?
You mean in the phone?
No. I mean the book, the papers, BNF paper one.
You can, the thing is you can buy it, or if you have a soft copy, you can print it out and keep it as hard copy. It's up to you.
No, I don't mean that. I mean like how just I get I mean, how can I say it?
Okay, you need to find it in BNF, right?
Yes.
Okay, go in the index, and then in the index, go in the part of that, like we already discussed. This will be index, right? In the first page, check index number. For example, it is 1712. Go to that number. In the actual book, because there are certain pages they have not written, they have not numbered them. So it will be somewhat after 1712. It will not be exact 1712. Go a little bit farther until you reach index. In the index, this is A portion of index. Go to the D portion of index. And then look for doxycycline there.
So then I will find any interaction and any information about this drug, right?
For the interaction, as we already discussed in the real BNF, check this one portion, appendix 1, interactions, this one,
yes.
1444. And then go in doxycycline and check for interaction.
I mean, it will be in alphabetic, I mean appendix part. when I go to the interaction part, I will find it in alphabetic order, right?
Yeah, so these are two different portions. In the actual book, interactions will be at one, interaction is a separate portion. So all the interaction, drug interaction, you will find here in appendix 1. But in the index, if you are looking for renal dosing, we are not doing interaction now, we are looking for renal dosing, right? Renal dosing will be in the index part when you will open doxycycline.
So if I get it right, index part for renal dosing, is it like that?
Yeah.
Okay, thank you.
If you can get the real book, it will be easier for you. It's difficult, I think it's difficult to find it out on a PDF version as compared to the real book. Real book is a little bit easier to handle. Okay, so let's move on to the prescription. So as we discussed earlier, we are going to write APIXABAN in the anticoagulant portion of the chart. So this is the anticoagulant portion of that chart, this chart. If there is no, then you can write it down in the regular part. Then same thing, 2.5 milligram oral, start date. If you are writing down something which is for longer duration and or a regular medication, you don't have to write down any stop date for that because you are continuing this medication. And then sign it. And in additional information, you can mention EGFR. Why you have changed the dose because of EGFR. And then morning and evening, write down the timing. And I have written down date here. You can write down date here as well in the start. In this portion as well, if you have this portion.
So if we write the date on the top, no need to write it in the APIXABAN area,
yeah.
right?
Perfect. Yeah. And then antibiotic portion, write it down for me. Doxycycline, 100 milligram. It's an OD dosing. So date. And then here you will write down the timings. It's an OD dosing, so you can give it midday or in the evening. For example, I have written, I want to give this doxycycline at 12. So circle it. And then it's done. And then next thing was the atenolol. So in the regular part, you will write down atenolol like this. Write down the dose, route, start date, and when you are going to give the drug at in the morning, 8 o'clock. And then either you can write down the date in the beginning of the page, or you can write down the date here. If you have a portion like this portion, then you can write down the date here. But sometimes date is written separately like this. So you have to write down date with each and every drug. Okay.
So we can't write atenolol below the APIXABAN page, that one?
No, because this is an antibiotic one. See, this is the page for antibiotics. Sorry, and not antibiotic, anticoagulants one. Has the VTE risk assessment been completed? Please take. And here you can write down only the anticoagulants.
Okay.
If there is no page, specific page for anticoagulants, then you can write down APIXABAN and atenolol together. Okay, let's quickly have a look at this task as well. You are FY2 in medicine. Miss Hannah, age 60, has been admitted because of breathlessness. She was diagnosed with PE and was managed in the hospital. She is a diagnosed case of hypercholesterolemia. She had a long haul flight 10 days ago. EGFR is 87. D dimer is 4000. CTPA is showing hyperperfusion. She was prescribed these medications. APIXABAN for 6 months. Regular meds are atorvastatin, aspirin. Patient is allergic to codeine. She gets itching after taking codeine. Write down the prescription for the above medication, check dose, and write down APIXABAN as well. So, first thing, EGFR is written as 87. Anybody can tell me what is the normal EGFR? Anyone, please?
90.
90 plus, yes.
Yeah.
So this is almost 90, so it should be fine. We don't have to care about it here. And then because the thing I was mentioning in the previous station, you are writing down APIXABAN here. You have given APIXABAN in the previous station as well, but the dose is different. Why? Because treatment dose and prophylactic dose for APIXABAN for DVT-PE is different. And when you are writing it down for non-valvular AFib, then dose is different. So if you open BNF, then you will be able to see the dosing, and dosing is treatment dose for DVT and PE. Treatment dose means somebody who is having DVT and PE, or somebody who is suspected to have DVT and PE. Someone coming with shortness of breath, someone coming with leg swelling, and you are suspecting DVT, or someone coming with shortness of breath, tachypnea, tachycardia, you are suspecting PE. So in that case, this is the treatment regime for APIXABAN you will be following. For 7 days, 10 milligram BD, and then after that, 5 milligram BD for 3 months or 6 months, depending on the history. So you will do VTE assessment for the patient, and then you can come up with the dose. But you don't have to go in detail. But what you are going to do for the time being is you are going to write it down for 10 milligram BD for 7 days, and then you will, in the next column, you will write it down for next month or so. You don't have to keep filling out prescription chart for next month. You don't have to do it. Just fill out the prescription chart. For example, it is showing 15 boxes in your chart. Then fill it out in those boxes, because maybe patient is discharged before that time. So you don't have to write it down on other charts and make it 3-month time. Just complete that chart. Is that clear? And then if by any chance, if you have to write down prophylactic dose of DVT and PE, prophylaxis can be because of many reasons, can be because of surgery, can be because patient had a surgery, or patient had hip replacement, or some other reason. So in that case, prophylactic dose will be 2.5 milligram BD. If it is transient, then 3 months, or provoked. Provoked means if there was a risk factor for PE or DVT, if there or patient had a surgery. But if patient was not having any risk factor, then you can give it for 6 months. And if there are multiple episodes of VTE in the past, or VTE was very, very severe, PE was very severe, patient ended up in ICU, then you can write it down for lifelong as well. And then this dosing we have already done. In prophylaxis of stroke and systemic embolism in non-valvular AFib, then 5 milligram BD is the dose for that. If you have any concerns, you can't remember it, open BNF in the exam and just check to be on safe side. Another twist in this task. You have been given APIXABAN. This is a new drug, and then statin and aspirin are his regular medication. So we don't prescribe aspirin with blood thinners. APIXABAN, RIVAROXABAN, lower molecular weight heparin, things like that. When you are giving treatment doses, you don't have to prescribe aspirin because there is increased risk of bleeding. So you have to omit aspirin. Don't write it down, although it's written in the chart, in the task. This is one task And another task is also similar to this. You are F2 in general medicine, 55 years old. Mr. John Holmes was admitted with left leg pain and swelling. He went to South Africa last week and returned just 2 days back. It means that this is a recent DVT. So what you have to do is you have to type rivaroxaban, amlodipine, aspirin, and paracetamol. So same thing. Omit aspirin, don't prescribe it because you are giving blood thinner to the patient. You can give amlodipine and you can give paracetamol to the patient. So paracetamol can be given as regular, can be given as PRN. It is not written here, but you can write, if you are writing regular paracetamol, then if you open BNF and check for paracetamol, regular dosing is 1 gram QDS 4 times a day, and PRN dosing is 1 gram 4 to 6 hourly. It should be written in the task, but if not, you can write it either as PRN or regular on regular side, right? And what is the treatment for DVT and PE? If you are talking about rivaroxaban, it is 15 milligram BD for 21 days, followed by maintenance of 20 milligram OD for 3 to 6 months, according to BNF. Similar task, I think I might be having somewhere. So see this one. Is this picture clear to you? I have written APIXABAN 10 milligram BD for 1 week. So this is 1 week. After 1 week, everything from this side is clear. If there is any doubt, you can ask me.
So in case of aspirin, do we write it and strike it off, or we don't write the aspirin at all?
No, don't write it.
No, I mean the patient is taking those medications regularly, right? The aspirin.
Yeah, but you don't write it, right? Because patient cannot have it. If you have written it and maybe somebody can give that aspirin accidentally to the patient, just omit it, don't write it. Okay, so let's talk about APIXABAN now. For 1 week, you are going to give 10 milligram BD. So this is the week you are going to give. After that, I have written down these crosses. These crosses mean nobody is going to give this medication. If I have crossed something for a day or for some days, then nurses will know that and they will not give that medication during that time. For 7 days, I have given, and after that, I have crossed the medication. After that, because we are going, and date is important. This is an old prescription, so this is an old date. For example, if you are talking about today's date, it's 7 today. So 7/6, and then APIXABAN 5 milligram BD for a duration after when patient can have APIXABAN as half the dose, 5 milligram BD. So instead of 25, you will write as here after 7 dose, and then we have crossed out these part. This part is crossed out because we don't want to give this medication during this part. That's why it's crossed out. We want to start from this part. So whenever this course will finish for 7 days, patient can have it for 5 milligram from here onwards. It will be for 3 months, it will be for 6 months, we don't know at the moment. Is that clear? Any questions?
No, doctor, thank you.
Okay, so these are the prescriptions from today because it's already 2 hours and I'm giving you a task. For you have to write, we have filled out the other prescription, the first 2, and the next 2 I have told you what to do. So I want you to write down these prescriptions. You have time till tomorrow, and then you can upload your answers in the group. I will have a look And then if there is any correction, I will do that. And then I can fill out the prescription for you for like we have done it for the previous one. I can fill it out for you guys and then upload in the groups and Facebook group and WhatsApp group. Okay? Tomorrow, but you have to do it by yourself. If you are not doing it by yourself, you will not understand this prescription thing.
Hello, doctor.
Yes.
I'm just asking, do we have to take history in this prescription writing, or just we have to write the prescription?
There is no patient inside, so you can't take history, right?
Only we have to fill up the forms.
Yes. If you are filling out the forms correctly, checking out interaction, checking out allergies, and everything is perfect, you will get marks for IPS and everything.
Okay, and there is no need to verbalize anything.
No, because there is nobody inside.
Okay. All right. Thank you so much.
If there is something, for example, in dexamethasone, you are not sure about the next dosing, so you can say, I will be asking my consultant about the possible duration. But even if you are not saying that, that's fine.
Okay. So if any confusion is there, so we can say like, I will confirm with my seniors.
Yes.
All right.
If you have patient in the exam, then obviously you are going to take a history. You are going to talk to the patient, but don't do detailed history. Just get history for 2 minutes or so, and then start writing your prescription. If there is patient inside, what normally they do is they will give you for example, they will give you the prescription till here, APIXABAN, and then regular medication you have to ask from the patient. Patient will tell you, I'm taking a atorvastatin 20 milligram OD and aspirin 75 milligram OD. And then you can write it down in your prescription chart.
Okay.
If you have everything here, then it's well and good. But if there is regular meds are not here and you have been asked to write it down, then you can ask the patient. If there is no patient, your task is very simple. Write down your prescription in a proper way and you will get marks for that. Can somebody share the group link here in the chat?
Sorry, before we go, please. Two things. Then, if there's no patient to talk to them, then how do they score for it? That's one. Then, secondly, this is there a way we can get